Israel has been praised for the progress it's been making in vaccinating its population. The government says it hopes every Israeli citizen will have been inoculated by the end of March. But Prime Minister Benjamin Netanyahu is also facing flak for failing to organise supplies of the vaccine for some 5 million Palestinians living in the occupied territories. Critics say they have been left to fend for themselves. DW's Tanya Kramer reports.
A COVID-19 testing centre in the West Bank town of Ramallah. The infection rates in the occupied Palestinian territories have been high in recent months. So far, people here have had to wait for any vaccinations. While in neighbouring Israel, the vaccination drive has taken off quickly, human rights groups have criticised Israel for not helping to finance or supply vaccines to Palestinians. But this week, the Palestinian government announced that it had secured vaccines from several companies. The health ministry signed an agreement with 4 companies to import vaccines. The shipments will arrive during the coming 2 months. We will start vaccinating the medical teams, old residents, patients, until we vaccinate 70% of the residents in the West Bank, Gaza and Jerusalem. The prospect of the arrival of a vaccine has been welcomed, albeit with some reservations. We want all of us to take it to feel psychologically at ease because we are in a constant state of worry. But they want to bring the Russian vaccine and we do not have much faith in the Russian vaccine. At the end, I hope we will get the appropriate vaccine and we will be done with this crisis because it has affected all the sectors in this country. But they will have other options. The Palestinians have also signed up to the COVAX program in partnership with the World Health Organization. It aims to help low-income countries to get a fair share of vaccines for around 20% of their population.
Gerald Rockenschaub heads the World Health Organization's Office for the Palestinian territories, and he joins me now from Jerusalem. Dr. Rockenschaub, how dire is the situation in the Palestinian territories at the moment?
Well, equitable access to corona vaccines is a challenge globally, but, the inequity probably is nowhere as visible as it is in the Israeli-Palestinian context, with 2 million Israelis having been vaccinated so far, but no Palestinians except for those residing in East Jerusalem.
Well, exactly. That was going to be my next question. I mean, Israel has already vaccinated more than 20% of its population. Why have the Palestinian territories been left behind?
One part is because there are global shortages of vaccines and there is a lot of competition. That's why this COVAX facility was created, to ensure that also those countries who can't get vaccines on the free global market get their fair share of the vaccines. And we're working with the Ministry of Health very closely to ensure that all the preparations are in place to receive vaccines through this COVAX facility, hopefully during the first quarter of the year.
Why has it been specifically hard for the Palestinian territories to get access to the vaccine then, if Israel hasn't had such a problem?
Well, the Israelis procured at the global market. They entered agreements with private companies. The Palestinians had some challenges in that respect. They are primarily relying on the COVAX facility, but they're also exploring other channels. There are discussions with Russia, with China, also with private companies, but also other countries, frankly, have difficulties to mobilize the adequate quantities of vaccines at the moment.
Well, there has been a push by some richer nations for an equitable distribution, and you talk about the COVAX strategy. Even though we're seeing it play out here, are poorer nations losing out?
Well, for us, it's primarily a public health and an equity concern. So we also have some consultation with Israeli counterparts. And in our meetings, we have flagged that there are a number of good public health reasons for Israel to support the vaccination efforts on the Palestinian side, potentially even to allocate some vaccine supplies from their supplies, particularly to target the health workforce in Palestine.
Well, the Israeli Prime Minister has said that Israel wants to help its neighbours. Are there any concrete plans of how that might look?
Yeah, I mean, we have very good discussions with COGAT, the military administration, also with Ministry of Health, technical people, just to ensure that all the coordination mechanisms are in place, that customs clearance processes don't create any obstacles once the vaccines start to arrive through the COVAX facility or through other channels, and that all the preparatory efforts and national vaccine deployment plan, cold chain assessments and so forth are in place.
All right, Gerald Rockenschaub, head of the World Health Organization Office for the Palestinian Territories. Thanks very much for your time.
Thanks very much.